In the following, we will show a real-world case study of a 73-year-old patient in a hospital using MEDIHUB Stroke, JLK's complete stroke platform. The following page shows a fully automated, AI-powered stroke image comprehensive analysis procedure, supported by MEDIHUB Stroke. MEDIHUB Stroke is a platform that can be aligned with the American Stroke Heart Association's guidelines for the international use. In this case, we will introduce the use of MEDIHUB Stroke in a hospital that uses CT and MR. The patient is a 73-year-old male who presents to the emergency department with an altered mentality that started 1 hour ago. The patient had a previous history of hypertension and angina pectoris and an NIHSS score of 22 on presentation. Stroke is a critical illness where there is a golden time, and how medical team quantitatively cares for the patient within this time is associated with the patient's life and future disability-free life. 7 products from JLK's complete stroke platform, MEDIHUB Stroke, were applied to support the physician's decisions quantitatively and quickly for this patient. The patient concurrently underwent a non-contrast CT scan in accordance with the hospital's acute stroke protocol. In this patient, JLK-ICH did not reveal any lesions suggestive of hemorrhage. The patient presents 1 hour after symptom onset and does not show a clear difference bilaterally on non-contrast CT alone. On the other hand, JLK-CTI revealed hypodense areas suggestive of ischemic stroke. JLK-CTI offers a summarized view of NCCT images, featuring an overlay that highlights hypodense areas and uses a heat map to indicate variations in hypodensity. When applying the JLK-CTL solution on a non-contrast CD, the HU value was low on the left side, and the net water uptake calculation showed suspicious edema on the left side. A clot sign was identified in the left middle cerebral artery, and a very high probability of large vessel occlusion was suspected with an LVO score of 79.1. The aspects was found to be 5 out of 10, and the HU values for each area are identified. JLK-CTL provides detailed descriptions of the features used to analyze the presence of LVO, aiding physicians in interpreting AI results. The patient underwent CT angiography imaging after a non-contrast CT scan. MIP imaging of the JLK-LVO solution reveals occlusion of the left middle cerebral artery. If you check the relative vessel density map, you can see that the vessels on the left are less dense. The heat map image shows the area of occlusion, with an LVO score of 100, indicating an occlusion of the left middle cerebral artery. At the discretion of the medical team, the patient was administered TPA after CT angiography, followed by endovascular thrombectomy. The JLK-ICH solution allows for faster TPA administration without the risk of cerebral hemorrhage, and the JLK-CTL and JLK-LVO solutions provide quick and quantitative information on the vessels that need to be treated. The patient underwent a non-contrast CT immediately after the procedure to check for bleeding. You can see the contrast enhancement because the CT was taken immediately after the procedure. Checking the JLK-ICH solution shows that the contrast-enhanced lesion has a volume of 5 ml and a probability of hemorrhage of 66.1%, indicating that the lesion is less likely to be hemorrhagic. The patient underwent MR imaging the next day. The diffusion image showed a region of high signal intensity in the left middle cerebral artery, and the JLK-DWI solution also showed the infarct lesion in red. The volume of the high signal intensity region in the B1000 image was 15 milliliters, but when filtered by the ADC, it was confirmed to be 3 milliliters. The solution showed how much the lesion in the brain infarction overlapped with motor and language areas, with overlapping areas colored yellow. Upon the patient's initial presentation in the emergency room, atrial fibrillation was detected. Taking this information into account, it was further confirmed that a cardioembolic stroke was the most probable diagnosis. The left middle cerebral artery vessel, which was occluded, is found to be well patent on MR angiography imaging. The JLK-UIA solution can be utilized to identify brain aneurysms in MRA images. Brain aneurysms are identified in the artery cavernous ICA, and the maximum diameter, height, and volume are automatically calculated. White matter degeneration can be measured using the JLK-WMH solution in the FLAIR image, and the volume of white matter degeneration is found to be 33 milliliters. The JLK-LAC solution can also be used to determine lacunar infarct location and volume. A repeat CT scan 5 days post-procedure confirmed the presence of hemorrhagic transformation, with a volume of 1 milliliter in the JLK-ICH solution, and an 88.9% probability of hemorrhage. A repeat CT scan 4 days later showed resolution of the hemorrhagic transformation, and no cerebral hemorrhagic lesions were identified in the JLK-ICH solution. JLK-WMH also analyzes hypodense areas, suggestive of white matter lesions. JLK-WMH offers a summarized view of NCCT images, featuring an overlay that highlights hypodense areas with a heat map to indicate variations in Hounsfield units. Not only a summarized view, but JLK-WMH also provides a report that contains an interpretation of AI results. From this report, medical staffs can explain AI results to patients with more ease. In summary, the patient underwent diagnosis and treatment following the outline sequence, and it was confirmed that JLK's MEDIHUB Stroke can be used seamlessly at every step in stroke care. In an urgent and complex situation in stroke, which is associated with a golden time and involves a person's life, 7 products from JLK's integrated stroke platform, MEDIHUB Stroke, was able to provide quantitative and fast metrics to support physicians.